one thing I'd like people to know is that the Cleveland Clinic is committed. I'm committed to building an access portal for musculoskeletal care, and we hope to service the local and regional community in a first-class manner. I've always been interested in medicine. Figured I was going to go into medicine even in junior high. Probably my sports background and getting injured and bumped around got me to the medical world a little quicker than most, and I found it very appealing, very interesting, and I just gravitated to it with my science background, etc. And I started to do some research early that got me right down the pathway in a surefire way, and I've carried on ever since. So I see patients, anyone from young teens with traumatic injuries, people with wear and tear problems, weekend warriors, all sorts of folks, even professional athletes. So it could be someone who's doing too much on the weekends and paying the price for it in their shoulder or elbow and need a solution for that. Could be someone who has peripheral neuropathy problems, who's having numbness, tingling in their hand and finding that intractable and difficult to deal with. So a variety of diagnoses and patient population. I think what I want my patients to know is that I take the time to get to know them. I take the time to make the diagnosis right and treat them from the beginning to the end. And I like to work with a team that I think of healthcare professionals that can do the best delivery for our patients, from our nurses, our medical assistants, our therapists, and ultimately, if they require surgery, taking them through that pathway.